All right, back with part 2 of the immune system. So we're going to talk about passive and active immunity. And this sometimes can become a little bit confusing, so make sure that you're paying attention here. So with passive immunity, this is when someone receives antibodies from an outside source. So an example of this would be a baby receiving antibodies from a mother's milk. So the mother is producing the antibodies and delivering them to the baby. Another example would be a doctor possibly injecting someone with antibodies. Now, active is when your own body produces the antibodies. You can either get a disease or receive a vaccine, and that would be an example of active immunity. Now, you may be thinking, if someone's injecting a vaccine into someone, how is that active? Well, to understand that, we have to understand where a vaccine comes from, the idea behind a vaccine. And with a vaccine, what's actually happening is the doctor is introducing a dead or very weakened version of that pathogen into the body. And when that happens, the body has to then fight it off on its own. So for example, if someone were to get a flu shot, there may be 6, 7, 8 of the most popular strands of the flu, but that doesn't mean that someone can't get the flu, because they may get that 9th or 10th most popular strand of the flu. And because of that, someone that receives a vaccine, it doesn't necessarily safeguard them from all strands of the flu, just the ones that they get a vaccine for. And just because they get a vaccine doesn't necessarily mean that they are 100% immune to the flu either. So using a vaccine in most cases is very beneficial. But in some cases, depending on the individual, depending on the strand of the virus that you wind up contracting, you may still get that virus or pathogen to show symptoms in the body. In most cases, it will be much more mild than if you did not get that vaccine. So we're going to talk about different examples of infectious diseases caused by different pathogens. So the first thing we're going to talk about are bacterial diseases. So strep throat is the most common bacterial disease, and it's found typically in the nose and throat. And some symptoms would be swollen lymph nodes, a sore throat, headache, fever, and it's diagnosed by swabbing the throat. So they actually take cultures, and we'll have to see if there is a bacterial infection. Lyme disease is also very popular. This is contracted when you are bitten by a tick. Some symptoms would be a red rash at the bite site, fevers, chills, and body aches. We also have bacterial meningitis. It's an infection of the spinal cord and the fluid that surrounds the brain. Some symptoms would be a high fever, headache, vomiting, and a stiff neck. And then finally, we're going to talk about tuberculosis. And this is transmitted when droplets of an infected person's cough or sneeze are inhaled. Some symptoms would be fatigue, mild fever, and a constant cough. The disease may not show up for years after contraction, so you have to keep that in mind as well. Sometimes you can be asymptomatic, meaning that you have no symptoms, and you may have the disease or carry the disease and not know it. So we're talking about treating a bacterial infection, which is going to be quite different than treating a viral infection. So antibiotics are used to treat bacterial infections. You can only get this through a script or a prescription. So your doctor has to write a prescription for you in order to acquire antibiotics, or you have to be in a hospital and the doctor would have to prescribe them there. Antibiotic resistance can happen over time, and that's basically when someone consumes antibiotics and the bacteria then do not die because of that particular antibiotic. And what would have to happen is the doctor would have to prescribe stronger and stronger antibiotics. And that's because pathogens, they mutate very quickly. And with the very quick mutation of the pathogen, it causes some really serious issues. So when a doctor prescribes someone an antibiotic, always take the entire prescription as indicated by the doctor. So on the prescription, if it says to take the antibiotic once a day or twice a day for 7 days, and that's what the prescription is for, follow it to the T. When you get to day 4, if you're like, I don't have any symptoms, I'm just not going to take this anymore, chances are that that bacteria may not be fully dead. You may not be experiencing many symptoms, but if it's not dead, it has a tendency to mutate very quickly and reproduce. And when that happens, you'll become more sick and you'll need a stronger antibiotic to get rid of it. So always take your prescription as indicated by your doctor for the full length of time. Next, we're going to talk about viral infections, and these are much more common. So we have the common cold. Symptoms would include sneezing, sore throat, coughing, chest congestion, headaches, and muscle aches. Most last 3 to 7 days. Colds typically spread when a person touches a contaminated object or inhales the droplets from a person's sneeze or cough. Influenza, it's an infection of the upper respiratory system. Some symptoms would be high fever, sore throat, headache, and a cough. It spreads the same as the cold, so both of these spread in the same exact way. Then we have pneumonia. All right, pneumonia is when the lungs experience inflammation and fluid buildup in the lungs. It makes it very difficult to breathe. People with a lowered immune system, so someone who has heart disease or someone that's elderly, someone with HIV, they're going to be the people that are more susceptible to pneumonia. And then last, we're going to talk about hepatitis. This is a disease of the liver. It's transmitted through human waste, blood, and sexual fluids. It's the number one reason for liver transplants in the United States. So keep that in mind as well. So we're going to talk about some treatment of viral infections. And in most cases, there's no particular medicine that can cure a viral infection. The best treatments are rest, a well-balanced diet, and plenty of fluids. There are also many medicines that treat viral symptoms. These medicines make a person feel better, but they do not get rid of the virus. The body does that on their own. In some severe cases, someone could be given antiretrovirals are medicines that will help to destroy the virus, but in some cases, that's typically not going to be the case. They're not going to get those. You're going to use over-the-counter medications. So when should you see a doctor? You should see a doctor if you have an extremely sore throat, earache, vomiting, diarrhea, or a temperature of 101 degrees Fahrenheit that lasts for more than 2 days. Mucus from your nose is thick and yellow, and what that is typically an indication of is that you may have a sinus infection. If you have difficulty breathing or severe pain anywhere in the body, a cut or scrape that doesn't heal as it should, or an illness that lasts longer than usual. So some preventions, I know you guys have heard these things over and over the past few days, but they are so important. Washing your hands. Anytime you touch something that you think may be contaminated, or maybe that you think isn't contaminated, but you just touch something and you feel as though you just need to wash your hands, wash them. Wash them as frequently as possible, especially right now. Making sure that you're not touching your face after you touch an object is integral as well. So making sure you're washing your hands. Do not share items that transfer pathogens. So towels, eating utensils, cups, hairbrushes, all of those things can possibly transfer pathogens. You do not want to share those. Cook and store food properly. A lot of times this goes overlooked. Some people will leave things up on the counter for maybe a couple hours and they put it in the fridge. And sometimes when you leave food out, even for a short period of time, there can be certain things that wind up growing on it. Bacteria and different things love to congregate, mold on food very quickly. So make sure that you get those stored properly. Avoid contact with infected individuals. All right, that's 6 feet of space. All right, make sure that you are practicing that social distancing. Do not go near people. Also, make sure that you're staying inside right now. We got to make sure that we're staying inside and not spreading different pathogens to one another. Stay home when you're not feeling well. All right, super important, especially right now. Learn to manage stress in healthful ways. Having high levels of stress can actually damage the immune system, make you more susceptible to getting different types of viral infections, particularly the flu and cold. Also, it can cause different pathogens to progress more quickly. All right, so staying stress-free. What are some ways you can do that? For everyone, that's different. It could be just talking to someone. It could be organizing your thoughts, maybe writing them down on paper. It could be doing something as simple as playing video games, maybe taking a nap, listening to music, reading your favorite book, watching a good TV show. All of these things can help you manage stress in healthful ways. Sometimes just attacking the problem head on, just getting things done quickly. I know for me, not procrastinating, that's a perfect way for me to get rid of stress. Just get things done. Sleep at least 8 hours a night. This is extremely important. Your body resets your mental capacity. Also, it's been shown to file things away when you sleep and you hit REM sleep, which is the rapid eye movement portion of sleep, which is the deepest sleep. And you only get a few hours of that a night. And if you're not sleeping 8 hours, you cut that time down. So make sure that you're getting your sleep, and also avoid unhealthy substances such as drugs. Drugs, not only sharing different things with other people can be harmful, but it also diminishes your ability to make decisions. So you may be doing things that you normally wouldn't do, taking risks that you normally wouldn't take. So you want to stay away from those. They also suppress the immune system. So definitely important to stay away from those. And that's it. That's it for this section. This is part 2 of the immune system. The next section that we are going to take a look at is going to be the emerging diseases. And with the emerging diseases, we'll take a look at those, some reasons as to why diseases emerge. And we're going to be done with this unit. There will also be some work at the end and a test for this. So make sure you check that Google Classrooms.